I was diagnosed with breast cancer. February the 17th made a year. I finished my last session of radiation. I went to have my yearly checkup, and my gynecologist told me that I was at the age for a mammogram. And me being stubborn, I was like, I'm not going to take a mammogram. I'm not going. And something just said, go take it. And when I went and took it, 2 days later, they called me back and said that I needed to come back for some more images. I was like, more images? So I came back, and they told me then that it was cancer. And my mind just went all over the place. And she told me, she said, I can bet my money on it that it's not far. You're still in early stages, and we're going to get you through this.
So February is Heart Health Month, and we're here today to talk about certain radiation and cancer techniques that we use in order to protect a woman's health during treatment for breast cancer. And so as part of Heart Health Month, I wanted to read a few stats that I thought were particularly pertinent right now when we talk about your treatment for breast cancer, Ms. Coachman. And so that is one, this is from the American Heart Association. So cardiovascular disease kills nearly 50,000 African American women annually. And that's a shocking number. And what I found interesting was that on African American women ages 20 and older, 49% have heart disease. And so what that means is, when we talk about designing your radiation plan for left-sided breast cancer, the heart is located on the left. And so, one of the reasons that we use what we call cardiac sparing techniques, there's two techniques that we use to protect a woman's heart with breast cancer. And basically, one of the treatments is, if possible, we will have her lay on her belly, face down, which is called prone positioning. And we'll show you some examples of that. And then in Ms. Coachman's case, what we did was use a breath hold technique. And that's a little bit trickier because you have to hold your breath. But it is a way that by inhaling, if you can picture it, what you do when you inhale, right, is you move your chest wall away from the underlying heart. And so that moves the breast away. And so we're actually able to treat when you're holding your breath, and then you relax, and we can treat again. And so we're able to effectively protect the underlying heart and lung from high dose radiation much better than we can with older techniques. But yeah, it's a little tricky, isn't it, the breath hold? Yes. Was it hard for you?
It was like the first 2 weeks.
Yeah.
The first 2 weeks was very hard. It was aggravating. But once you get used to it, it was just like, because I did it for 15 minutes. And I held my breath in 30-minute increments. So the radiation go around, I let out, hold it, or it come back around, and I was done.
Yeah.
So it was just the point of being there and can't move.
Right.
You can't move an inch.
Right.
But you have to hold your breath for 30 minutes, and I got used to it.
Yeah, we're very precise.
Yeah.
We're better for worse.
Yes.
But yeah, you did great though.
Thank you.
So, and I'm like I said, with how young you are and everything that you've been through on this journey, I'm really glad that we were able to help through too.
Yeah, that's what I told them. I said, y'all the best.
Aww.
Even when I wanted to give up, those nurses around there was like, no, that's not an option.
We have good coaches.
Yes.
So we have a very good team. We're very fortunate.
An excellent team.
Thank you.
And I thank you all.
My pleasure.
So what we see here with Ms. Coachman's plan is, if we think about her anatomy, pretend the patient's head is here and the feet are here. So this is the right breast, this is the left breast. So in her case, what we see here is the radiation dose covering the left breast, and you can see that she's expanded her lung so that it's not near the heart. And we can see that down here as well. Here's the heart, right lung, left lung. And you can see how we're able to minimize the radiation dose there. Now for this patient, similar, I'll give you another viewpoint. Here's the heart, and here's the left ventricle in dark red. That's what pumps blood to the rest of the body. And here's a major artery, a major coronary artery called the LAD. And you may have heard of the LAD. It's called the widowmaker, because When this hardens or becomes clogged with cholesterol plaques, the patient typically can have a heart attack and it can be fatal. And so the LAD is something we really want to avoid with our radiation planning as much as possible. And so again, this patient has also done the breath hold technique. You see the high dose radiation in red, and you see the very low dose radiation here, and we were able to just skim and avoid the LAD with any kind of significant hot dose of radiation. And as I scroll down here, you'll see how we were able to do that for her. So this is a technique that we use in order to spare a woman's heart. And I think any woman with left-sided breast cancer really needs to have this conversation with her radiation oncologist to understand what techniques can be used to help reduce her chance of long-term toxicity from the radiation, especially as we discussed with Ms. Coachman. You know, if you're African American or already have risk factors for underlying heart disease, it's something that we really need you to be aware of.
Through these mammograms, it can be detected. Cancer period can be detected. You have to go and get your checkups. I went through it. I fought through it because I had a purpose. I had a son. He just turned 11. Who's to say what would happen if I hadn't had my checkup, hadn't had my mammogram? And now I'm on it. Like, I wasn't doing breast exams. I'm on it now. It's just a whole different outlook. It's better to know than not to know. And then when you know, it's too late. Last Tuesday was my first year cancer-free, so I celebrated. 1 year down and many, many more to go.